Before we jump into today's topic, a quick disclaimer. The stories and data we share come from the states that we practice in and the experiences that we personally had, which can differ greatly across our country and certainly the globe. This is not a professional advice show. So let's get comfy and talk about death.
Welcome to MortMic, a down-to-earth discussion on death and dying. I'm Jem.
And I'm Red, and we're your overseers of the odorous this week.
Warning, warning, warning. Today's episode content may make the faint of heart a little bit squeamish. Please proceed with your comfort level in mind.
It's no secret that death gets a little messy sometimes. And from the pre-mortem dying process all the way to the post-mortem changes, there's a lot of opportunities for some ooky things to progress. We've lost count of the amount of dead bodies we've come in contact with over the years. But even after all this time, there are still certain things that make even our skin crawl. I have this weird thing sometimes where I'll try to watch a horror movie with body horror in it just to push my limits to see what gets a rise out of me, because ever since I started embalming, the typical things really don't get my goat anymore.
Yeah, actually, that's something I'm going to talk about later, but I am not a horror gore kind of person. I cannot handle that kind of stuff.
So there's all sorts of things that we can deal with and not even bat an eye at, like being wrist deep in an organ bag from an autopsy and snipping at the bloated intestines to release gas, severely infected and oozing bacterial skin infections, bone out traumatic auto incidents, dead body farts. This is all run-of-the-mill day-to-day stuff for us. But there are some absolute things that have to make me walk away from the prep table sometimes and catch a breath.
Yeah, absolutely. I think that people think because we're exposed to these things so often that we must be used to them. We see it every day, it should be no problem. That is absolutely not the case. And what I've found is that everyone has their thing. So something that might make Red, squirm in her boots a little bit is not going to make me do that. And, something that I find absolutely disgusting is something Red's going to just be like, oh, whatever, it's not a big deal. So it's really individualistic in that sort of way. And I think that's why it's going to be really fun to talk about what sort of makes our hair stand on end.
Yeah, absolutely. So why don't you start us off with your nasty, creepy thing that you don't like?
The first thing that I wanted to talk about is going to be my absolute least favorite thing about doing autopsies, about doing transfers. Anyone that ever has worked with me will know this about me. And the thing that I absolutely cannot stand, and I hate to the end of my days, is poop. It's poop. And I know that people deal with poop every day. Nurses, taking care of the elderly, taking care of babies. I cannot do it. I don't know what it is. Poop is always going to be in the death industry. It is a very, very, very normal thing that happens to pretty much everyone when you die. You hear that I think it's a common, quote unquote myth that when you die, your anal sphincter relaxes. And this is absolutely true. And anything that is in that area that was, being held back or, waiting, for you to use the bathroom next, it's coming out, and it's wherever you are, however you die, it's more than likely that you're going to be pooping yourself. I'm sorry. But that's just, it's just, slimy and smelly and gross. And one of the things that we have to do in autopsy is we have to remove the intestines. And if you have never seen intestines before, it's kind of like a long, slimy tube that's extremely bendable and oftentimes just chock full of poop. I don't care how often you cleanse or how many probiotics you take. Your body is full of poop, and I hate it. I hate your poopy body. But so when we're taking out the bowel, it's a long tube. It's feet. It's yards and yards long. So we're taking it out with a scalpel. One of the worst offenses in my eyes is nicking the bowel. So this means creating a hole in the bowel so that all the poop comes spilling out into the body cavity, onto the table, onto the body, onto my hands, onto my apron. And it's the worst. Like, I don't know, Red, if you have any qualms about poop, but I actually, before I wanted to be a mortician, I was thinking about being a CNA, a certified nursing assistant, and the only reason why I did not do that is because I did not realize how much poop they have to deal with on a daily basis. Like, I literally was like, nope, I can't. Not with poop. Nope, it's not happening.
I would definitely have to get those, like, elbow-long latex gloves if I was dealing with, like, live people actively pooping. I personally don't mind a whole lot. Like, half of my job is literally cleaning up poop from dead bodies. Like,
it really is.
Like, you think you've got it all, and there's just so much that comes out. Like, please stop. Which I would love to go into anal vaginal plugs, but there's more time for that in a different episode.
Absolutely.
But yeah, it's not that bad for me personally. Definitely not on my top 5.
Yeah, out of all of the body fluids, it's definitely just awful. Gastrointestinal bleeds, it's where you have a bleed in your intestines and your blood mixes with your poop and it just comes right out because it's just watery and bloody and gross. Terrible. Baby poop, stinky, smelly, oily, terrible.
Yeah, it's so much worse than like adult poop. Why?
And, that's just the worst for me. Of course, there's other body fluids that are just like terrible. And, Red, what's like one of your like body fluids that you can't stand?
Okay, so it's gotta be for me snot. Like goobers, all sorts of stuff. It's just, it goes... So gross. Half the time, like, I pull boogers out of people's noses that, like, you could swear come from the brain. Like, that's how far back they go. And they're usually, like, really crusty and, like, full of blood or, like, vomit and stuff. And it kind of goes hand in hand with, like, my next one, which is mouths, which is why I hate mouths so much. Because a lot of the times, there's a lot of snot in there.
Yeah.
I mean, obviously, we all know that, like, your mouth and your nose, like, they're all connected. So, like, a lot of people who are, like, passing away are usually very dehydrated or, like, can't keep food down. So, like, their mouths are all, like, dried and cracked. Their tongues are all cracked. They usually have a lot of, like, vomit towards the end of their life. So that's coming out of their nose. That's, like, caked in their mouth and dried by the time we get them.
Yeah. And also what you can find in there is purge.
Yes.
Which is the fluid in your stomach kind of regurgitating. Remember, we talked about sphincters. So there's a sphincter on top of your stomach, and that also will relax after you die. So the food that's in your stomach starts to kind of like come back up, and it has to go somewhere. It comes out your mouth. And that's what purge is called. It's usually kind of like darker colored. It's not blood unless, there's a stomach bleed. But it's just like basically like dead people vomit is what purge is.
Right.
And it's terrible. Like, we're moving the bodies around, like snot is coming out of your mouth, coming out of your nose. It's like goopy and just stringy, and it's gross. It's just gross.
And there's all sorts of stuff in purge too. Like it could be just like stomach content. Sometimes you get lung purge, which is all frothy and bloody and could have like fluid in the lungs, so it's like, yellow. Oh.
I will say quickly that opening a stomach, because we do examine the stomach during autopsy too, opening a stomach of someone who ate like a huge like meal recently before they died, and just kind of like being able to see exactly what they ate, like whether it's like, penne pasta or like a little bit of broccoli or something like this, it's a little gross too. You're just like, oh God, I don't think I can eat penne pasta for a couple of weeks.
Oh, definitely.
I think a big thing with the grossness factor in death is definitely revolved around the face and like the facial features. So for me, when I was getting into funeral directing, I think now it doesn't bother me as much, but I still wanted to bring this up. It's the eyes. The eyes of a person can, that's kind of like the first thing that people look at to tell if you are with it or if you're not with it, if you're alive or you're dead, because dead eyeballs, people die with their eyes open. This is something that I don't think people realize. If you are unconscious or you die, like sometimes your eyes are open. And I think everyone has this image in their mind of like, the hand going over the eyes slowly to close the eyes after someone dies. If you don't do that right away, your eyes are like gonna stay open due to rigor mortis, which we'll discuss at a later episode. But like you're dead man staring at someone basically, and it's
haunting, honestly.
Yeah, it is. That was what kind of scared me the most when I first started in the funeral industry. And Red, maybe you can talk to us a little bit about how you get those eyelids closed during the embalming process, because that was my least favorite part for sure.
Yeah, eyeballs are incredibly difficult to look at when they're like empty, devoid of all the light. But in order to get them to be closed, we have to break rigor.
I do like doing that. That is really fun for me.
Yeah, it is kind of fun. It helps you be able to position the eyelids where you want them to naturally rest. But the biggest thing in order to keep eyes closed is something we use called eye caps, which are these little plastic discs that can be circular or ovoid. And they have tiny little grippy spikes on them. And so we set those over top of the eyeball and then lift the eyelids over them and let them settle naturally. And those little spikes keep the eyelids from flapping open, which is really disturbing to think about if it was on your eye, like
your actual
a live eye. Yeah.
Yeah. Think about a hard plastic contact lens with freaking spikes coming out of it. It's like putting it into the eyeball like that. That makes me a little squeamish. I don't like thinking about that. That was something that I was like really just messed me up when I was a young funeral director.
Oh, for sure. Eyes gross me out in the respect of like, it still kind of goes hand in hand with snot, because sometimes people have these huge eye boogers that at the intercanthus that you're just like, the
little eye crusties.
Yeah, the crusties. Ugh, so nasty.
Sleep crusties, dead crusties.
Speaking of crusties, something that is starting to rank up on my list of things that I hate are going to be nails, especially toenails. It's the least cared for part of your body when you get older, I swear.
It is. I think the worst thing for the feet for me, I don't know, they're just so like floppy and just like like the toes, like they're dirty, and especially if like Red said, if they're not cared for, when you get older your nails kind of tend to get like thicker, and like if you're not taking care of them you could have like fungus is very common to see, I think. Very like thick, grown out, like yellow, like monster toenails just like coming for you. You know what I mean?
Yeah, definitely. And calluses that look like they've been walking on like hot sand for years. Like thick calluses, bunions.
Thankfully, we don't have to do much with the feet. At least we don't, right? I don't know if your funeral home like puts on like socks and shoes and stuff like that.
Yeah, and that's where the toenails really get me, because when you're trying to put on nylons and the toenails are like scratching at the inside of them, it's just like, oh god, it's so nasty.
Actually, an interesting thing that I don't think that a lot of people know about. So when you donate your organs, to either like a gift of life program or like an organ donation program, they will take your long bones. And what this means is that they'll take the bones in your legs and in your arms so that, they can be used for bone repair, bone transplant, things like this to help living people. It's really great. But so when they take your long bones in a dead person, they want to put something back there to kind of like give the appearance of a leg that is no longer there, because without your bones you're literally just like a skin sack flopping around.
Right.
So what they do is they stick PVC pipes where your long bones used to be, and that, for me, that's like a really creepy thing, especially the legs, because they'll take your long bones, they'll take some of the skin on your legs, but they'll leave your feet. So it's like this skinny little PVC pipe coming out of your hip with a little floppy foot attached to the end, and I hate it so much. I cannot, because like you pick up the PVC pipe and the foot's like whoop 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 whoop, like it's just too much for me. I just cannot.
The first time I ever unwrapped a body, that's a weird way to put that, but I'm keeping it. Unwrap a body that had donated long bones in the legs, I actually kind of laughed because it's very comical looking because it's just like
It is,
butt cheeks with two little sticks hanging out of them and then these little feet on the end and there's just like one tiny inch long strip of skin that is just like wrapped with string to the PVC pipe. Like, it is bizarre that's like kind of what they came up with. But
I know, and it's like little skinny. It's not even big PVC pipe. It's skinny. It's probably like, I don't know, 2 or 3 diameters. But, of course, like, donating your organs is super important. Like, I think that everyone should if they can, but you just have to keep the humor in the embalming room sometimes, I think. Like, it is just a very silly looking thing at the after effect of, donating your long bones.
Right, exactly. So going along with extremities, hands get me because of one specific, and it's not clinical, but I am designating it hand cheese. Hand cheese.
So, yeah, what I think you're talking about is when you die or when you're not, taking care of your skin when you're a little bit older, the cells, like the first layer of skin cells, like start to die and like kind of flake off. So that's probably what you're talking about, right?
Yeah, exactly. Except like tenfold, especially when somebody's in the hospital for a long time or they have like extremely bad arthritis where their hands can't open very wide. So, of course,
and they probably couldn't use their hands a lot.
Exactly. And people aren't really worried about cleaning their hands off and trying to like open their fingers enough to clean the palms of their hands. So you end up with this like all this extra skin that just it's sweaty and it gets really like, that's what I'm looking for.
It looks like Parmesan cheese.
Yeah, pretty much. It's spreadable. That's what the consistency is, which is an awful thing to relate that to.
It's awful. It is.
I always come into contact with this at the worst times, usually when I'm not wearing gloves. Like I'll be removing jewelry, before I close the casket for the family, taking the bracelets off and everything. And I have to get rings off and I'm like, grab the hand and I just like, I have this moment where I'm like, you cannot let the family know what just happened with your facial expression. Act normal, please.
I have this image of my mind of like this like somber funeral and Red's like, you're in your funeral attire, like leaning over the body and the family, they're always like watching you like a hawk, always. And you're just like removing these jewelries like with this hand, she's like coming off into your hand, just trying not to like cry, like screaming internally.
Yeah, it's like, I guess I'll just wipe this on my new suit.
That's so funny. Another thing what happens with that, which I weirdly have experience with is, and I think a lot of nurses kind of joke about this too. I saw a meme about it recently, but when someone's wearing socks in the hospital and you go to like rip off their socks, oftentimes you'll get like showered with like a little snow shower of skin flakes. And so there's this meme that says, it's like a nursing meme and it's, it's like every time you go to remove your patient's socks and it's just like this like I think it's a gif of like this cartoon cat with like little like snow coming down on it and like piling up on its head.
I wish you could see my face right now. That's so gross.
It is. I hate it. It's whenever I take off socks from the hospital patients now, I'm always like, ooh, careful. I don't want snowflakes today. Going along with that kind of like gross skin vibe, something that really kind of grosses me out. So when you get older, your skin also gets really thin and it gets super fragile. Very, very fragile. Like, so the thing that I'm going to talk about, what can happen if you've ever experienced this before, it's just awful. If you grab an older person's skin, I think especially if they are like nearing the end of their life, you can literally like tear the first layer of their epidermis from the dermis, from the muscle underneath. And it's like, it literally feels like if you put a tissue paper on your arm, like wrapping tissue paper, and just like put your fingers on it and like moved, and it tears like tissue paper. The feeling is like so similar. And it's just always, because first of all, it's usually on the arms and the hands when you're trying to move the body. You grab grandma's arm and you kind of hold on like you would a normal arm and you pull and you like feel the tear and you're like, oh no, because that's like it's hard to repair, I think, isn't it, Red?
Yeah, especially to get it to stop from leaking. I mean, we can use super glue and stuff like that to try to like flap it back over, but it's never 100%. You have to wax
It's
that.
just a terrible, like, it's kind of like a texture thing. Like, the tear feeling is just awful. And as soon as you do it, you're just like, oh no, like, I'm so sorry, funeral director. Like, I did not want to do this. And it's not fun for anyone involved.
It's really not. It's hard to repair, and it only gets worse, like, the longer somebody's passed away for, like, then obviously decomposition starts, and skin slip starts to happen in major, major ways, where, like, you can deglove somebody pretty easy at that point.
Yeah, actually, just a little side note, you know, like, when you see on the FBI criminal shows where they take off someone's, like, finger skin and they put it on their own finger to like get into their phone or like fingerprint access, whatever, you know what I'm talking about?
No, I've never heard of that. That's cool.
Oh gosh, I'm so sorry, I'm like in my own little world here. But so the degloving of the hand, if you're decomposed enough, the first layer of your skin on your hand will come off, and it's disgusting. It's just so creepy. So in a case of decomposition that we had, we couldn't identify the person because they were so badly decomposed, but the hand glove, for lack of a better word, that came off, you know, we literally took off the first layer of skin on their hand. We were able to, the doctor literally put the hand glove on his own gloved hand, thankfully gloved
No
hand.
way.
And used a police fingerprint scanner to identify this person.
That is so BA, man.
Yeah.
Science.
I think I've seen it in like on TV, and it's cool because that's actually something that we can do, but it's like definitely really creepy. I feel it's almost like serial killer, like,
Skin
you know, putting the skin putting the dead skin of your the hands of your, you know, victims on for whatever reason.
Very Ed
like,
Gein.
It is a little creepy.
So finally, time for my poop.
Yeah. Your crowning poop.
It's got to be blood clots. And, you know, the common folk are probably used to the concept of a blood clot being this very tiny little thing that if it breaks off, you know, could cause issues with lungs, et cetera, et cetera. And that is not the case in what kind of blood clots we see. So after somebody passes away, of course, the blood is no longer moving. It starts to coagulate inside of the vessels, and you get some monster clots. I'm talking big old noodles of blood clots. And there was one embalming I did where I inserted the angular forceps into the jugular vein, angled down into the heart. And that is to manually pull out blood clots, because when you create pressure, all the clots start to move towards the exit. And you need help pulling those out. And so I was like not getting any flow. No blood was coming out. And I'm like, wow, this person must have a lot of clots. And I finally, like, I feel like I grabbed something and I pull. And swear to you, this like 6 to 8 inch clot comes out. The head of it had to be as big as like a nickel around.
Oh, wow.
And it was like, it wasn't just like the black brown blood. It was like plasma goo in there too. Oh my God. It was the nastiest thing I've ever seen. I had to I dropped my forceps on the table and it was just like, get it down the water, get it down to the drain.
That's so funny because I love blood clots. I think they're so cool. Yeah, I love them. And so like Red was saying before, so when you're embalming someone, basically, since we haven't really talked about it yet, crash course, they cut open the carotid artery and the jugular vein, and you're pumping formaldehyde into the body and chemicals, dyes, all of this. And what's coming out is the blood that has settled into the body, that's been settling there. And especially if they've been sitting for a long time, you know, of course, the blood is going to be settling more. It's going to be forming these clots. And these clots are actually called postmortem clots because you don't get these clots in real life. Like if you're sitting down for a long time, you're not going to get postmortem clots.
Can you imagine getting a clot like that from sitting down for too long? Oh my gosh.
They're very like big and like coagulaty and like lumpy. And you'll learn through this podcast that pathologists love comparing like how things look to food, and I don't know why.
No, like, that's totally a thing. We did it in embalming school too.
So what they call these clots, how you distinguish them, because if you look at them, you can actually distinguish them from like an in life clot that formed in life while the body was alive, which is really cool to determine, like, did this person die of like a thrombus, or is it just a postmortem clot? So the postmortem clots, they actually separate into that like plasma-y, like yellowish kind of, like there's a top yellowish, like shiny plasma-y part, and then the bottom part is the heme of the blood, like settling. And what they say it looks like is like chicken fat. Yeah. To be honest, I don't really see it, but like I can understand. Like it's a very like fatty, like shiny, like glompy sort of just like, I don't know, little guy. I love them. I like see them, and they're just like, I don't know, they're kind of cool. They just like slide around, and you know, but definitely with embalming, I think it's a little bit different than doing an autopsy, because these like huge glompy things are just like coming out of the jugular vein, just like huge glomps, and it is really kind of like pulling a booger out, like, you know what I mean? I don't know how else to describe it.
Definitely, especially when you have like a bunch of them and all of a sudden the flow kind of like starts to come out, and it's just like an eruption of just blood and like clots, and it's awful.
So even though poop bothers me the most and it's terrible and I hate it, Red seems to be fine with it. You know, no one likes poop, but it's fine. And similar to Red being just the gargantuan clots is not something that Red ever wants to think about, probably has nightmares about. People are squeamish about different things. And I think what a lot of people outside of the industry, what I get a lot of questions about are things like the bugs we might encounter. So we're talking maggots, we're talking flies, we're talking bed bugs and lice. Honestly, for me personally, I do not mind them at all. I think they're kind of cute. Like, besides the whole like infectious factor, I think little maggots, they look like little rice-a-ronies just like scooting about on the body. They're just their little bellies are full of blood, and you can kind of see it moving around in there. I just think they're little cute little guys. I like them. I kind of like them.
Maggots aren't too bad, actually. I could kind of agree with them being like kind of adorable, because they're not gonna like jump out at you either. They're just kind of like,
yeah, and they don't bite you. They're just kind of there.
Yeah.
And so maggots are baby flies, and another kind of food-related thing that pathologists compare this to, like I said before, maggots are often compared to little rice grains or little rice-a-ronies, but they come from fly eggs, and you can tell if a body has fly eggs laid on it because it looks like Parmesan cheese. I know we compared the hand cheese to this before, but it literally looks like a dusting of Parmesan cheese over the whole body is what fly eggs tend to look like. And the crazy thing is, if you are outside and you're in the right environment, flies will find you and they'll start to lay eggs on you within hours of death.
Yeah, they're pretty much, they're on top of it. They were born for this.
They're good at their job.
I think for bugs, for me, definitely not too bad, especially when if you can see them, like, then I can conquer them, so it's okay. Like, I have seen some very intimidating lice on one case. However, I had never seen lice that big before. They were very well fed. If I'm going to have a problem with any bugs, it's going to be bed bugs, just because I lived in the city before and I've had them before. And it's just like, not again. I'm not doing this again. It's not even like I'm scared or like afraid of them. I just don't want to deal with them again at my own house.
Yeah, absolutely. Knock on wood. I've never had bed bugs before, but that's definitely a big threat in the death care industry. So thankfully, bed bugs are, they don't last long after someone dies, as long as you get their clothes off and you kind of give them a good wash. We actually tend to freeze them, so we put the body in the freezer and try to freeze them off. But it is definitely something that you just want to be extra careful about. Like, whenever a funeral director comes to pick up a bed bug body, they will not open the bag even. They'll just be like, nope, we are not even risking it. Like,
literally the only time I wear full PPEs is when there's bed bug cases.
I mean, that's legitimate, to be honest. So as you can see, there's a lot of really gross things that we do see every day, and it still kind of gives us a little bit of the heebie-jeebies. We're not just in here not scared of any sort of thing when it comes to like gross bodies. And actually, like I said before, as a death professional and, you know, I work in the medical examiner's office, I see a lot of gross things, but I cannot do the horror gore thing. Like, that is not me. And I don't know what the disconnect is, but I can do like 5 autopsies a day on a decomposing body and, you know, whatever you throw my way. But when it comes to certain things, it's just, nope. It's not happening.
That's really interesting. Anybody that's listening, if you have the most awful, gory, nasty movie, please send it my way, because I need
only to Red,
only
not
to
to
me.
me.
Right, definitely tag it for me, because I need to feel something, because a lot of things just don't get the rise out of me anymore, and I really want to challenge myself, so definitely send it my way.
Yeah, and that goes if you have any other questions, like, you know, why didn't we talk about this certain thing? Have you ever heard of this? Definitely shoot us an email, because we just touched on the things that are prevalent for us. But if you're wondering about, I don't know, bed sores or amputations, we could definitely talk about something like that.
Yeah, absolutely. There are so many things out there. Even though we've handled hundreds and hundreds of bodies, we haven't seen every single case possible. So it's always interesting to hear input or have questions, things that help us look into stuff for you guys too.
Cool. Do you want to end it there?
Sure.
Okay. Unless you want to say anything else, we can take it out.
I'm solid.
Okay, let's do it.
And that's all for this week on MortMic. We'd love to connect with you guys on our socials like we said, so like, follow, and subscribe to us on Facebook, Twitter, and YouTube at MortMic Podcast. That's MortMicPodcast. It would mean a lot to hear your feedback, so please tell us what you think in a comment and drop us a rating on whatever podcast hosting site you use. If you have any suggestions on topics you'd like to hear or any burning questions you have about death, shoot us an email at mortmicpodcast@gmail.com.
I just want to say we really appreciate all the comments that you guys have been posting on our Facebook and on our Podbean website. It's really funny to see that everyone liked the human soup topic last podcast. So we really appreciate all your feedback. We really do. And honestly, we read every single one of them. So thank you so much for that.
Yeah, thank you guys.
I also want to give a huge thank you to our friend Marson for the use of his song titled Deputies of Death, which he produced just for our show. You can check out his Bandcamp at Marson. That's MARSON music.bandcamp.com. Thanks, Marson.
And be sure to tune in every other week on Thursdays for more casual discussions on death. Thank you so much for listening, guys. This has been MortMic.
Bye.
Bye.